All right. So, Danny, many of the topics that we've covered in these talks can be subsumed under an acronym called BART, B-A-R-T. Useful, the character linked to the character of Bart Simpson. So the letters stand for boundary, authority, role, and task. Those four headings, familiarity with them should enable one to sustain oneself in the role of osteopath appropriately and helpfully, both to the osteopath and to the patient. So boundaries. We've spoken about boundaries between the professional role and the patient role, because the patient's also in a role, remember. Other practical boundaries like the room, the time, the fees. Okay. And then, of course, the psychological boundaries between, recognizing the boundaries around the patient, which is often, interestingly, skin and is a boundary, between what's inside and what's outside. And sometimes we know that space, that boundary space, could be extended. Usually people have a kind of space around themselves. It's reckoned to be 24 inches, which is their personal space. And transgressing that, crossing that boundary, can feel like an invasion. Okay, authority. So there's the authority of the profession, the training that you've had, which is supported by the white coat you wear, and other things in the room, and so on. But it also leaves the patient feeling somewhat secure and safe, that should anything require a complaint, that there's someone and somewhere to complain to. So that's a good boundary also to maintain. And the other one, so that's authority, the boundary of authority. Role we've spoken about a lot, and also task. Now, the question of task is an interesting one, because that cropped up several times in the workshops around what's the task of the osteopath. Is it to alleviate only physical pain, or is it perhaps a combined task of physical pain and psychological pain? And often the osteopaths complained that they were not trained in the psychological task.
Right.
And we know from your experience and your work and your exposure to psychological thinking that there is a relationship between physical pain and emotional pain. Okay, so, all right, so have you got any reactions to what I've just said?
Two things, a few things. Just start with the last point you made about the connection between psychological and emotional, physical and emotional pain, which sort of got me into this in the first place, was the realization that, or the belief that so much that was coming into my clinic was underlined by a emotional or psychological factor. And in order to really help the patient, I needed some sort of training or some sort of technique or tools that allowed me to manage that side of things well. Firstly, in order to help the patient in a more effective way, and second of all, to help myself avoid any problems, conflicts, and emotional distress as well. Sometimes it can be very damaging or distressing on the part of the osteopath to be faced with those difficult emotional patients. They can affect your practice, affect the way you feel about yourself, and affect basically how you yourself are as an osteopath. So that's that, and for that reason I felt that I needed to have a further training in that, and I strongly believe that all osteopaths should have a good understanding, not just a superficial understanding, a good training in that side of the osteopathic patient encounter.
Yeah. All right. So I think we should end on one final point, which you reminded me that you say all osteopaths should have some training in the psychological and emotional components or factors of physical pain. Now, of course, that suggests that you are referring to the formal training of osteopaths, and in a very crowded curriculum, it's unlikely that time could be found for this kind of training. So perhaps the way forward is to think about post-professional training, the kind of training that occurs after you've qualified. And one good way of attending to that is to form groups, is to have seminars, perhaps with an osteopath who's trained in psychological methods, or a psychotherapist, or both, as we did. We did it in partnership. But the point I want to make is that learning about a psychological process once isn't going to stay with you for long. It's something that needs to be repeated throughout one's professional career, and working in seminars and communities of practice is a very good way of going about it.
Absolutely. I think the colleges should introduce psychology and psychotherapy into the curriculum to start off giving the students a grounding. They should actually, I believe, form this sort of training within the curriculum itself, as you say, in small groups, but certainly the group aspect and the experiential aspect of these workshops is that which permeates the osteopath and creates learning.